Hi health advocates, welcome back to my channel. In the last couple of videos, we discussed how to utilize the health management glossary to get familiar with a couple of the words and their meanings to better health advocacy. And then we discussed healthcare communication and the impact it had between you and the clinician. And lastly, we discussed health literacy and how it affects everything we do, including healthcare use, healthcare costs, healthcare status, and healthcare outcomes. Now for the last video of this series, we are going to discuss the differences and the effects of medical jargon and medical terminology. Medical jargon is commonly used terms and words that are spoke inside every single health practice that have multiple meanings and a broad description. Words that fall under medical jargon can vary from office to office. Clinicians try not to use medical jargon because these words are often unfamiliar to patients. Whereas medical terminology are words and terms that have a universal description and are used to precisely describe the human body. Medical terminology includes components, processes, and conditions affecting it, as well as the procedures that are performed. However, the same clinicians that avoid using medical jargon often want to put medical terminology into the mix of their conversation with their patients. And that way, there is a concrete way for everyday people to go onto the internet and look for the meaning of an unknown word that has a concrete definition. It is so important for everyday people to understand medical terminology for these three concrete reasons. Number one, it enables a path for a more seamless conversation between the clinician and the patient. Secondly, it serves as a universal language when communicating conditions and ailments. And number three, it enables healthcare workers and everyday people to provide and receive directions in treatment. Just like the two-way street that we discussed, as it creates an atmosphere for conversation. As we discussed, we can transform the traditional provider-patient relationship into an equal partnership in care. Now let's take a look in the following video that is in the Comprehensive Guide to Self-Health Management, Article 1.4, Healthcare Illiteracy, a Hidden Epidemic. In the next line of business, we are going to look at medical jargon and terminology and differentiate the two. Medical jargon is commonly used terms and words that are used inside every practice. They have multiple meanings and a broad description, and they differ from office to office. Medical jargon are commonly used words with broad meanings. For example, negative. Doctors use this word to mean normal. Idiopathic is a term where doctors use where there is no concrete explanation of what's causing the patient's symptom or condition. Another example is the word cancer, which refers to a general term of a large group of diseases that have uncontrolled growth and the spread of abnormal cells. But with medical terminology, it is a universal description used to precisely describe the human body. This includes components, processes, and conditions affecting it, as well as the procedures that are performed. The anatomy of medical terminology is first, the prefix. A prefix is placed in the beginning of the word to modify or change its meaning. Pre means before, so prefixes may also indicate a location, number, or time. The root is the central part of the word, and the suffix is the ending part of the word that modifies the meaning. Prefixes come before the word in medical terminology. Some examples are osteo, from the Greek osteon. Bonosteomyelitis refers to the inflammation of the bone and marrow. Patho, derived from the Greek pathos, meaning suffering or disease. Trans, from the Latin meaning excess, over, or beyond, which in medical terms contain trans and are many, like transfusion or transplant. Suffixes come after the word in medical terminology. Some examples are pathy, which is disease neuropathy, which is referred to the disease of the nervous system. Itis, which is inflammation hepatitis, which refers to inflammation of the liver, and ology, which is a study in science of cytology, which is a study of cells. Ooh, we've covered a lot. By being proficient in health literacy, you're able to showcase your health story and ramp up your good communication skills. And like Sally, allowing you to even better prepare for your office appointment. Once again, hi, my name is Jennifer and I am the creator of the Patient Better program. Welcome to my channel. This channel was created for everyday people like patients, families, and caregivers just like you to learn how to manage care more independently. Please share this video if you know someone that can benefit from watching. And don't forget to like this video and subscribe to my channel and click the bell to be the first to get notified for the most current health management tips and tools. And don't forget, as that really means a lot to me in helping me with my effort to spread my health management message. And that concludes our video for today, and I want to hear from all of you as to what medical jargon and medical terminology means to you, and what you would want others to know from your experiences, and put it in the comment section below. Remember, the comment section is created for and by everyday people, so make sure you don't disclose your diagnosis, as we do not support drug and device solicitors or provide any medical advice. But your comments would be fun to hear. And who knows, there might be an onlooker, let's say a healthcare professional, and you get a chance to disclose what their patients are feeling at the same time in the treatment room. And now for our next video series, we're going to discuss health management for telemedicine. Although I feel that I'm probably going a little ahead of this, I feel that you guys are ready to participate in a productive virtual medical office visit, just like you would with your regular in-office visits, with your regular professionals that help you with your chronic conditions. This video requires a higher level of health management skills. However, I have been hearing that there is a lot of misutilization for telemedicine programs among patients, family members, and at-home caregivers. This especially holds true for the 1 or 2 physician practices that needs their patients to properly use virtual medicine the most. These folks are already compromised in their health, and their primary caregiver or power of attorney may be living long distance and really need a virtual appointment for their chronic conditions and cannot put this off any longer. And I don't want that one person to put off a potential diagnosis for any longer. And I hope with these virtual telemedicine series videos that people will no longer prevent putting off a diagnosis. Thank you again for being amazing health advocates and of course being the best part of Patient Better. Until next time.